following on from the last PowerPoint on why evidence-based dentistry is important, I'm going to take you through actually undertaking evidence-based dentistry and the steps that you need to follow thinking about evidence-based dentistry, either in your own research or when you're looking at appraising other research. So there's a four-stage model of evidence-based dentistry. Firstly, you have to define the question. Secondly, you have to locate and then collect the evidence. Thirdly, you have to appraise that evidence. And then fourthly, you have to be able to implement the evidence. What I'm going to do is take you through each of those steps one by one, talk you through different aspects of each of those, and hopefully address any questions that you may have. So the first one is defining the question, a really key part of evidence-based dentistry. And this can be really difficult to do if you have very little experience of research. Because there's particular ways that we construct questions in research, and these tend to be very specific and very well defined. What I like to do in relation to defining the question is to think of it in terms of what we call Pico, so the Pico format. And all that Pico stands for is, firstly, patient or population, that's the P. The I is the intervention, the C is the comparison, and the O is the outcome. So if you think about deriving a question, thinking about those four aspects, hopefully you'll get to a very specific question that you can then search for. So how does it work in practice? So firstly, the patient or the population. So this is our scenario. There's a 56-year-old healthy male patient with chronic periodontitis and he's looking for treatment. He's afraid of dental procedures and would like to avoid staying in the dental chair. So what we want to do is we want to find out, what way can we treat him, what way can we make the treatment the best for this person. We've got to treat him, he's got chronic perio, but he doesn't actually like sitting in the dental chair. So what we want to do is we want to go and look for evidence to find the best way of treating him. So what's our question going to be? First, the patient or population. Well, this is a healthy male and he has chronic perio. The intervention, we want to find a treatment that is going to be stress or anxiety free. The comparison is obviously a typical dental treatment, and the outcome is obviously to reduce the perio, but also to keep his anxiety at a minimum. So how do we convert it then to this Pico format? We've got P, patient, adults with chronic periodontitis. I, the intervention, is the periodontal treatment with sonic and ultrasonic scalers. So these are ones that you haven't got that drill noise. If you look at the dental anxiety literature, one of the key things that people are afraid of is the sound of the drill. So if you use a scaler, which doesn't have that sound, so a sonic or ultrasonic one, that may reduce the anxiety, so that's our intervention. The comparison is just your standard treatment with manual instruments. And the outcome, well, firstly, effectiveness, because you want to know obviously whether you've reduced the attachment gain. It could be pocket probing depth reduction, and also efficiency could be used as an outcome because obviously for him he wants to have treatment in less time. So it could be measurement of treatment time, could be an indicator of efficiency, or you could measure anxiety. So this is the question in that Pico format. In adult patients with chronic periodontitis, which non-surgical periodontal treatment, so sonic or ultrasonic scalers or manual instruments, is more effective in terms of probing pocket depth reduction, attachment level gain, and efficient in terms of the duration of the treatment? So you can see there that the question has become very specific in terms of what it's asking, what the population is, what we're testing, and what the outcomes will be. So now we have a very specific question. We can go to the literature and search for the evidence to see whether there is actually any evidence out there which suggests that sonic and ultrasonic scalers will be more efficient, effective in this situation. So this is step 2, searching for the evidence. There are many different ways, different resources to find evidence. And there's a number of computerized databases that you should think of first, because these have got the kind of best evidence, if you like. They have got peer-reviewed papers and articles which provide good evidence to answer these kinds of questions. There are many, many different computerized databases available via your library at the University of Sheffield. So if we look at one of these, the Web of Science, which you can link to via the library homepage. I'm just going to go into it. This is the Web of Knowledge, Web of Science database. This is the one that I like to use because it covers a number of different disciplines, whether that be medical, dental, and also social science ones. So what you do is you enter in the keywords for what you want to search on. I'm not going to do the exact one that we've just worked up there. I'm going to do something which is very similar. So I'm going to do it on periodontitis, which is, I'm going to put that as in the title. So here you can see in the drop-down menus, you can have keywords in the topic or the title. I'm going to put it in the title. And, you know, what are we interested in? We might be interested in, say, the role of stress in periodontitis. So I'm going to put in stress, and I want that in the topic. But I'm only interested in recent-ish articles. I don't want to trawl back through to the 1800s, which is where this database goes from. So I'm just going to put in 2002 to 2012, just so I get the most recent articles. You can do that by putting year published over here, and then you press search. And it finds all of the articles which have been published with periodontitis in the title, looking at stress in the years 2002 to 2012, and you can see here we've got 196 articles, which is quite a lot. And you can go down, you can look at the titles and see whether they're relevant, for example. You can pull down here, have a look, and see whether there's any that you think answer your particular research question. You can then click on these and it will bring up the abstract, which you can then go and have a look in the library or on the computerized databases for the full version of the article. Okay, so that's one of the computerized databases that we can use. There's also Medline and PubMed, which you may find useful. As well as computerized databases, there is also a very other important database, which is the Cochrane Library. And this houses all of the systematic reviews in particular areas. And so it's an incredibly important resource for you to use and be aware of. So if we just click on that, we will hopefully go to the Cochrane Library database. Okay, so here, this is the Cochrane Library, and if you scroll down, you can see these are all of the areas that there are systematic reviews in. Numbers in brackets are the numbers of systematic reviews, so you can see there's a great deal of them. I'm just scrolling down here to oral health. You can see there's 214 systematic reviews. If you click on that, it will bring up all of the different topics that those systematic reviews are in. So you can see there the different reviews. There's the most systematic reviews in dental caries, where there's 53, and oral and maxillofacial surgery, 34. And then periodontal disease, which is one that we've been interested in. Click on that, let's have a look. So there are 23 in all, 3 of them to do with gingivitis, 5 to do with periodontal disease and associated conditions, 8 to do with prevention, and 10 to do with treatment. Obviously, they're all going to be on different topics. The first step for you, really, is to go to the Cochrane Library to see whether there's been a systematic review carried out, before you then go on to look at Web of Science or Web of Knowledge. And I'll come back to the reasons for that in a minute. Okay, so I would say that the computerized databases and the Cochrane Library are the most important databases for you to get to grips with and to use. There are obviously other databases such as Google Scholar, which are important, and there are many types of information that you can find on the internet, but you need to be very, very careful with any information on the internet, because this is often not peer-reviewed. And certainly with regard to your assignments and with the modules that you will be doing within this course, it's important that you use peer-reviewed evidence only. So please be aware of the high yields of junk on the internet.